Hi, everybody. It's me. It's Dr. Kestler from Lorain County Community College, and welcome to another co-video. Couple things I want to get through today. First of all, let me start with my temperature. As always, I am 96.9 degrees Fahrenheit and 36. I will be going out in a little bit, but I'm going to be wearing a mask when I'm out, and I have all kinds of things with me to protect me, like Purell and such, because that is an important thing. I want to tell you about a story that this is just an interesting story, and I want to put it in context too, because sometimes when you're talking about science, you're looking what could be and not what actually is going on. And what could be, there was this study. It was a really cool study where they're looking at droplets from speech. As people are talking, they spray. If anybody saw there was a special on Gary Marshall on ABC a couple of days ago, and he says he sometimes sprays when he is talking, and we all do. Any rate, this paper was very interesting because it showed that some of the droplets from when you're speaking can persist in the air for like 8 minutes. And so, if you are walking in an area where someone has been and the air is circulating around, you have to think about that. So wearing a mask in that kind of an instance is a good thing, and also looking around and see who is wearing a mask. So if you're not comfortable with the percentage of people wearing masks, leave. You can leave at that instance. All right, a lot of people have been asking me about Kawasaki disease, and there has been cases of Kawasaki disease which have been emerging in children, and they really are not respiratory at all. They're immunological. And I will remind you of the awesomeness that is your immune system. The awesomeness of your immune system is that some people who eat a peanut will die in 20 minutes thanks to an immune system that is very, very powerful. That is a very powerful kind of a force, and it can do great things. It also can cause great problems. And the other thing, the thing about it is that this is a serious kind of a disease, and we have things like the cytokine storm, things like blood clots are the immune system's last ditch effort. It's like, oh, we've got to throw the kitchen sink at this problem. So a persistent lung infection in a child could lead to something like this Kawasaki disease, which can be quite devastating to deal with. So I just want to point that out. For the remainder, I'd like to talk about a conference I went to last night. And yes, I went to a conference in my living room, and there were a number of seminars and talks about all kinds of subjects, including about moving forward, about opening up, and all these kinds of things. It was a very eclectic panel of people. There were people who were public health people. There were people who were medical doctors. There were people who were involved with regulatory agencies, and that's what I think about. I think that covers everybody on this list. And there's also some epidemiologist disease modelers in the group. I thought I'd give you a little bit of a synopsis of some of the things that they said, and believe it or not, they recommended wearing masks, washing hands, and maintaining social distance, or maintaining physical distance, whatever way you want to call it, that kind of a thing. They also advised that watching the death rates can be somehow indicative if there is a problem. Unfortunately, that's a slow indicator that has indicated that there was a problem in the past tense. And they recognize the problem that has happened. I'm not going to say whether one way or another. We are opening up. That is what is happening, and there's no point in discussing it. That is what's happening. But we may want to open slower or put the brakes on. I just want to remember that the things on the top of this recommendations are things that you have control over. You can control wearing a mask. You can wash hands. You can maintain the distance that you like. And a lot of time they spent talking about new apps that were coming out from both Apple and Google. And these apps will probably not be all that we want to deliver for as far as contact tracing. I think that we as Americans do not have an appetite for extensive contact tracing on our cell phones, yada, yada, yada. And so, but they will be able to do something great for you, just like, the traffic program app Waze. Tell you where there's a lot of people. Hey, you might want to wait to go to Home Depot because there's about 100 people in that store right now. Okay, I'll go a little bit later. I'll change my plans, and that'll help you stay out of regions, especially if droplets are persisting in the air for a long period of time. You can go back when it's a little bit safer. They also recommended need for enhanced testing. We need to do, we are currently doing a process called the polymerase chain reaction, which is a bit cumbersome and is very difficult to scale up. We need something that is a little bit faster, and maybe even if it's not a great test, we can use that as a first line. In HIV, in my background, in HIV, we always ran two tests. When we diagnose people, we run two tests. There's the first one, and then there's a second one. The second one is a confirmatory test. So that way, we can catch as many people that way. The idea is to run one test and then do a second confirmatory test with a much better standard. One test that is a little bit harder to run a cheaper test first. And I think that they were really keen on that whole story. They also had some recommendations for colleges, which I perked up when I was, since I teach at a college, I was very interested. And they stressed the need for colleges to suspend large lectures. And that is probably going to go on everywhere. I know the University of California has already moved the fall semester to almost entirely online. And they also said that if you are a college that opens, that is a residential college, that you need to reserve some dorm rooms for a quarantine dorm. I remember my oldest son was at Bowling Green at the time of the H1N1 epidemic, and he actually got and ended up in a quarantine dorm where they put students. And so there is the capacity, there is the wherewithal to do these kinds of things. And so we can, that was their recommendation. They all had a prediction. And it was the same, I didn't have to sit there to listen to this because it's my prediction as well. I had actually said this earlier in the day, and that is there will be a surge. There is no doubt in my mind. One of the things that the experts told me was that our lockdown, and we know this from tracking data, from cell phone data, anonymous cell phone data, that we never really got more of like a 40% lockdown. Lockdown was not extensive. So that's that. That's what it is. But there will be a surge. You should be ready for that, should be protecting yourself for that, and especially those of you who are in the vulnerable population. And again, make sure you wear those masks. I just want to remind you that there are people out there making all kinds of cool masks. People who are sewing. There's fabric. They're looking for fabric like the one that Barb and Bob made for me. And for my wife Julie, shown here in the picture. Get a cool mask and try to really impress all your friends with your masks, and the fact that you can say things under your breath and nobody sees your lips moving, which is a really big plus. All right, I'm going to. We're about to enter into a little bit of a scary time again, I think, as we open back up. And, we all have to be good to each other. If you don't want to wear a mask for yourself, wear it for someone else. And wear it for somebody who you do care about. That is just something that we kind of do and be good to each other. And the helpers are the ones wearing the masks. So I'll leave it at that and say thank you all for tuning in. May you all be good to each other, and may you persist like a lentivirus.